Good morning, everyone. And thank you for joining us again. We have been having a conversation about the transformation of mental health through social work. We've been having a conversation about what it means to be a powerful social worker, what role that takes on for us, all of this. And we've been doing it both in these posts that we've been doing on a weekly basis on Mondays and Wednesdays, articles that we've been putting out, as well as a certificate course that we have on Fridays from 3:30 to 5 p.m. Eastern time, that brings together social workers from several different states and jurisdictions to have conversations about, and even out of the country, to have conversations about, for all of us, what does it mean actually to be a part of the transformation of mental health? What is our role? And we've been talking a lot about role, and we have been talking about where this, where we can have the most amount of impact, what all of that means for us, and in that conversation about what it means for us, there have been lots of different things that have come up just in terms of our own identity. That's been a huge driving force behind much of what we've been talking about, but also about the language. One of the members actually brought it up of this conversation that we've been having on a regular basis, brought up the importance of language in what it is that we're doing and how it is that we're doing it, and how we communicate things, the words that we use, are vital to any sort of transformation around anything. And in the last time we met, we spent a good amount of time even looking at the language we have been using about transforming mental health. And where it is we are focusing on mental health, if we also know that mental health is integrated into health, then the question also becoming about why do we then choose to talk about them as separate and distinct from each other, and what can occur in the language that we use that can bring and merge it together to be about the transformation of health, and what would that be like? What would that look like if there were this transformation around health, where things like, our annual physical exams that we have to do, or our annual dental exams that we do, are not the only annual thing that we do to maintain wellness and to operate from prevention. But what if there was also an annual mental health evaluation, to be able to operate from a place of wellness where a qualified specialist would have an opportunity to meet with us to see, where are we, what is our health status, in the context of our emotional health right now. So that's been some of the conversation, which has been very, very interesting. And as we kind of continue on in this, it raises, I think I had mentioned in an earlier video, that one of the members of this group also talked about, because of her age and her years in practice, whether or not she even had the right to have an opinion about the transformation of mental health or the transformation of health. And then we talked about things like age and race. And so when we are thinking about what this transformation is, also thinking about like how power dynamics play themselves out, and power dynamics in the helping relationship, power dynamics, and that can be a multitude of things, right? Power dynamics in the helping relationship when it comes to things like age, when it comes to things like working in a culturally diverse context. There are all of these different kinds of power dynamics that, myself as somebody who is considered in a privileged position, right? And, because I'm white, but there's also the context of being a woman, that changes some of that dynamic. And then there's also, whatever my other cultural groups or ethnic groups that I'm a part of, that people may or may not even know, because I can choose whether or not to disclose them because they're not as obvious. And so when we're in the helping relationship with people, and there are those like power dynamics where we may be coming into the conversation, with the belief system that we both have power in this relationship, and that you bring your expertise and I bring my expertise. It's not necessarily the way that our clients have been acculturated in, and it may not actually be, depending on what the cultural context is of the relationship. It also may not be what our clients actually perceive or what we perceive in terms of power dynamics. And then how does that then translate into a bigger picture and get played out and modeled out throughout the course of the work that we do on a bigger scale? And in this conversation about the transformation of mental health, like, what is the degree of cultural humility that we have in the system at large, individually and in the system at large? What is the degree to which we self-reflect on what it means to be somebody who is in the helping profession, and what the experience is like on a system-wide level, on the micro, macro, and meso levels, micro, meso, macro levels. Like, what does that look like in the context of culture, and in the context of inclusion and diversity and all of those things, and how do those things play themselves out within the relationships that we have with our clients, with the systems, and with other professionals. So I would love to hear your thoughts on this. Please join us in the conversation, and put your comments below. And we look forward to seeing you again very, very, very soon.